We're here at the Haley Body Slimming Clinic, where another doctor-prescribed option for weight management has just arrived. The Tirzepatide weight loss injection pen is creating a lot of buzz for its ability to help patients manage their weight effectively. To help us understand this treatment, we're speaking with Dr. Terence Tan, Medical Director of Haley Body Slimming Clinic. Hi Dr. Tan, thank you for joining us.
Hi.
So Dr. Tan, many patients have heard about the weight loss injection pen. How is Tirzepatide any different?
So before we talk about Tirzepatide, we have to talk about what came before. So I think previously we used to have some medications, and most of them are oral. And now we have an even more recent development whereby we have Tirzepatide. So Tirzepatide is slightly different from Semaglutide. It has got similar properties, but it's also slightly different. Semaglutide and Tirzepatide, what do? So they are manufactured to be very similar to certain gut hormones that we have in our own body. And these gut hormones are called incretins or peptides. What happens is that they look like our natural hormones. The body feels that they are our natural hormones, but they are able to last a very long time. So for example, for Semaglutide, Tirzepatide, it can last you for more than a week. And therefore, as an injection pen, you need to inject it once a week, so it's more convenient. But for all intents and practical purposes, the way it works is very, very similar to our own natural gut hormones. Our body can't even tell the difference. So both of them are analogs and will stimulate the receptors of GLP-1. So GLP-1 is a hormone that's produced when we eat, and when we eat, this GLP-1 does three things. Number one, it tells us we are full centrally over our brain, and that helps reduce our appetite. Number two, it stops the food from going down too fast, and therefore keeps us feeling full for a longer period of time because the food stays in our stomach for a longer period of time. Lastly, it also helps handle the glucose and the food that comes into our body. So it tells our pancreas and our body to secrete or release more insulin, and therefore able to store the glucose that comes in our body into our muscles and also into our liver. So that's where they are similar, but they are also a little bit different. So Tirzepatide, on top of being a GLP-1 analog, is also a GIP analog. Tirzepatide has got a stimulation function for GLP-1 receptors and also GIP. Most scientists and doctors would probably agree it has probably a better ability to reduce weight and probably with a little bit less side effects than Semaglutide, which was already very good in the first place.
So actually, what should patients know before starting this treatment?
Okay, I think that our patients will ask us three biggest questions before starting the treatment. So number one, how effective is it? Number two, what are the possible side effects? And number three, how much it costs? So studies have shown that for Semaglutide, slightly over a year, people lost up to about 18% of their body weight, which is actually quite impressive as compared to what was available previously. However, Tirzepatide, over a similar period of time, was able to lose more than 20% of their body weight. And this is really, really good because previously, before Tirzepatide came about, for the average person in the society to lose this much weight, they'll have to go for bariatric surgery. Surgery including making our stomach smaller, surgery to make the opening to our stomach smaller, and very invasive treatments like this. But now, we have tools in order to get a similar amount of weight loss just with an injection pen. Over 1/3 of the patients on Semaglutide lost more than 20% of their body weight. However, for Tirzepatide, more than half of the study population actually lost more than 20% of their body weight. So while it seems that Tirzepatide is superior to Semaglutide in terms of getting people to lose weight, I would say the verdict is still not very clear because so far there's not been any head-to-head studies, but a lot of people feel that perhaps Tirzepatide is more effective. Number two, side effects. So the side effects of Tirzepatide and the side effects of Semaglutide are very similar because they work in a very similar way. So for people who are not used to it, especially if they start at a slightly high dose, they are likely or they may get some nausea or some feeling of wanting to vomit. Some people might even have some constipation and diarrhea, but these are not so common. Other than that, there are very few side effects for the people who are starting with these medications. However, when we look a little bit deeper into the studies, it does seem that Tirzepatide might cause a little bit less nausea as compared to Semaglutide because some people or some doctors think that the GIP has got some effect to negate this nausea effect caused by GLP-1. But the verdict is still out there. How about the cost? Well, I think in terms of cost, different clinics, different institutions would price their product a little bit differently. But largely, they are pretty much similar. They are not inexpensive, but it would have been better if more insurance agencies were to recognize obesity as an issue and do a subsidy on these medications. So cost is an issue for most people. So when you're going to start, what do you do? First, of course, go and see a doctor. Maybe there's been some talk in the news that there are some healthcare providers who might be giving out these medications, online without a proper consult. But I think that's definitely not a good idea. See a doctor, get an assessment. The doctor will do a physical examination, ask you for your medical history, to check out your BMI, take your weight and height, and then discuss the pros and cons for taking the medication. For most people, a good risk benefit will include a BMI of above 30 or BMI of above 27 with some chronic illnesses. And this has been shown by most studies for the benefit to outweigh the risk of taking the medication, and perhaps even the cost. The doctor also will look out for what are the contraindications for treatment. So for example, a pregnant woman or a woman who is looking to get pregnant will probably not be useful because these medications are a little bit too new for their safety during pregnancy. So therefore, with all of that, then, as a whole system, you might get started on Tirzepatide. So all these weight loss injection pens, be it Tirzepatide or Semaglutide, adjuncts to a healthy lifestyle. And therefore, Tirzepatide is good, but it's important for us to treat the patient as a whole in terms of lifestyle, in terms of medication. It's just a way to support the weight loss.
So if you're considering the Tirzepatide weight loss injection pen and want to find out more information on how this might fit into your weight management plan, as advised, book a consultation or visit Haley's website and follow their socials to find out more.